I'll come back over here, so we're going to begin a little discussion, and much like the previous panel, I'm going to kind of lead off with some questions and ask the panelists to respond to it. But we'll begin with Dr. Hassink. Will you describe the problem with hunger from a medical or health perspective? In particular, why did AAP decide to focus on hunger? And what is AAP's new policy around screening for food insecurity?
So thank you very much, and it's an honor to be here today with you, Representative McGovern, who we know you're a fierce advocate for children and a leader in child nutrition, and thank you. And for an honor to be here and a privilege to be here with all of you, especially getting through all the snow that we had to get through to get here. I've spent my entire career in pediatrics focusing on the connections between nutrition and child health, and also on the universal truth that no child should go hungry, and that the health of our population begins with the health of our children. And I think we want to stay with those two truths today. Sound nutrition, along with stable nurturing relationships and safe and healthy environments, are the foundations of child health. And they are the foundations that guarantee that our population will be healthy, and that optimal nutrition starting in infancy sets a stage for a healthy childhood and a healthy life. And we know that children who are well nourished early in life have healthier brain development. They have to be well nourished in those early years when the brain is undergoing its most rapid developmental and growth phase. They have higher IQs. They have stronger immune systems. They have better educational performances than those children, those infants and children who are not well nourished. And I know as a pediatrician that the best medicine in the world will not be effective if I am treating an undernourished child. It will not be effective. So for pediatricians, nutrition is health, and it's a core component of health. And I think, and for many parents, it's a core component of how they are providing health for their children and families. Good nutrition is also chronic disease prevention. So when I talk to pediatricians about early infant feeding, and we do a lot of counseling about early infant feeding, we have many early visits, 22 visits before the age of 5. Early infant feeding is chronic disease prevention in this day and age. That's what this is, if you guarantee optimal nutrition for our youngest children. Good nutrition prevents chronic disease, and it also helps treat the effects of chronic hunger. And we're learning a lot about food insecurity and its impact on the child, both health-wise and also through the mechanism of toxic stress. And toxic stress means that when you're undergoing chronic unremitting stress, the stress, for example, of not knowing where your next meal's coming from, or the stress when you're in a family whose parents are highly stressed about food insecurity and having enough money, that causes biologic changes in the child. It causes changes in their hormones, changes in the way their genetics are read out. And this stress sets a child up, this toxic stress, for adult cardiovascular disease, diabetes, cancer, liver disease. In fact, next week I'm meeting with the Cancer Society, who is recognizing that sound nutrition in childhood now is a core cancer prevention strategy. So for many families, the stress caused by the inability to provide food for their family becomes worse at the end of the month, and it can be unremitting month after month and causes family stress and biologic stress in their children. And I want to point out today that the picture of food insecurity is increasingly a picture of a child who has overweight or obesity, who is consuming a poor quality diet, and you heard about some of this in the previous panel. And so our children now have a double burden of both obesity and food insecurity. And if you add together overweight, obesity, and food insecurity, we're approaching a 50% rate of nutrition crisis in our children. So the double burden of obesity and food insecurity coexists. It's global. It coexists nationally, locally, and even within families and individuals. So there are individuals that are stunted, don't achieve their growth potential in height because of early food insecurity, who later have obesity, and that is a double burden that's compromising health in our country. The connecting factor for this double burden is often poverty, and the highest rates of obesity are often found in people with the lowest incomes. And the challenge for our low-income family in today's food environment is having access to high-quality food. High-quality food builds and supports health. You can't make a healthy body if you don't have high-quality food. So recognizing the major implications of child hunger, last year the Academy of Pediatrics began recommending that all pediatricians screen children for food insecurity by asking 2 food insecurity questions and become familiar with federal and community resources that they connect the families and children to, and refer those patients in need of those services to food resources. And thankfully, we have programs like SNAP and WIC and school meals and summer feeding to ensure that children in need are able to access these programs, but they're often not enough. So only, as you heard, only 16% of children who qualify for free or reduced lunch have access to summer meals, and that young children may fall into the nutritional gap between school start when they're too old for WIC. But I just want to remind you that thanks to the tremendous efforts of Senator Stabenow and Senator Pat Roberts, we now have a child nutrition bill that addresses many of these issues. It keeps WIC strong and allows it to reach more children. It protects the progress we've made to give all students healthy school meals and food options throughout the day, and creates more opportunities to address hunger and malnutrition during the summer. So we're on the road, but as the Congressman said, we have a long road to go, but we are on the road. And I think we should spend some time thinking not how we're going to feed more children, but asking ourselves that why are we asking that question, and why are we sitting here as a country saying basically how many more children are we going to let go hungry this year? Why are we doing that? So thank you very much.
Thank you very much. The previous panel talked about SNAP as an investment, which I think that's the way we ought to refer to it. This is an investment. And Don, as a former SNAP recipient, I thought I would ask you whether you could tell us what led you to apply for SNAP, and what was your experience in the program?
Not long ago, my son and I were the face of SNAP in Idaho. I still vividly remember January 10th of 2010 at 5:30 in the afternoon. My boss, who was a bankruptcy attorney, called me into his office to let me know that he had to eliminate my position, and I was terrified. I was a single mom with a growing teenage son to take care of. While I did receive unemployment, those benefits did not even come close to replacing what I was making. I was relentlessly looking for a job, applying everywhere that there was an opening. But the recession was still in full swing. And with unemployment at 8.8% in Idaho, jobs were far and few between. I knew that if I was going to be able to take care of my son, I was going to ask for help. And I felt like an absolute failure as a mother. I'd always worked full-time and been able to support myself and my children. I tried to make ends meet. I stopped seeing my nurse practitioner who helped me manage my diabetes. I delayed paying the power bill as long as I could, but it wasn't enough and the food was dwindling. First, I decided to go to a food pantry. I was ashamed and embarrassed that I even had to be there. The staff made me feel welcome, and they gave me a big box of very healthy food. I was also relieved because I could put food in the pantry and fix something for my son to eat for dinner. The food I received from the food pantry was a big help, but it wasn't enough to get us through the month, and I was beginning to feel defeated. When I went to apply for food stamps, I sat in my car for an hour and cried before going in. It was very humbling as a parent to realize that you can't do something as basic as feed your children without help. I was nervous about what people would think of me. I was so glad when everything went well at Health and Welfare, and I was able to enroll in SNAP, and we got our benefits the next day. Receiving SNAP meant that we didn't have to go hungry, though it was challenging to ensure that we were eating healthy and nutritious food. My benefits for myself and my son were $317 a month. That works out to $79.25 a week, or $5.60 per person per day. Cans of chili, packs of frozen burritos, ramen noodles are a lot cheaper than meat, fresh fruits and vegetables. What I was not prepared for was how society would treat me, or how other people would look at me. At the grocery store, when people saw I was using my SNAP card, they were rude. There was eye-rolling, whispers, people pointed at my cart, even some hostility for the cashier. I started shopping late at night, so I might avoid all the judging people, And I even considered shopping in another town so no one would know me. Many people think those of us who need assistance are deadbeats and leeches who don't work and take no personal responsibility, when in reality, we're just like everyone else. Many of us have jobs. We have children for whom we want the best. We are trying hard to make ends meet from day to day, but sometimes life throws a curveball and you need a helping hand. Today, things are much better. In January of 2011, I found a full-time job with the state and I loved my job. In May of 2011, I received my last disbursement with SNAP. I got married in 2014 to my amazing and supportive husband, and my son is absolutely thriving. I've since left my job with the state and returned to nursing, and I couldn't be happier. I wanted to thank you for inviting me here today to share my story, and it's very hard to talk about. I mean, this was in 2010, and it's 6 years later, and it's still hard. But with so many stereotypes about what hunger looks like and who's on SNAP, I think it's important for people to know that the face of hunger looks like any one of us, and SNAP is a lifeline to families that fall on hard times.
Well, I want to thank Don, because I know it wasn't easy to kind of relive all of that, but I do think that one of the ways we're going to kind of change the politics of this is to expose people to the reality, and that means having to tell stories like this over and over and over again, because I think that some members of Congress, I don't think ever talk to anybody who's on SNAP. Maybe if they all had to live on $1.40 per meal per day, they might be a little bit more sympathetic to all of this, but there's a disconnect, and I think that we need to push back, and so I really appreciate very much you coming here and you giving this, providing us your story. And Mr. Mitchell, can you tell us how you've seen hunger affect children's ability to learn?
Well, first, let me start by saying thank you for allowing me to be here. It's a great honor to be able to share some of my work with the audience and also with the panel. Before I answer the question, I was just thinking a little bit about Dawn's story, and as I was listening to it and how powerful it is, and I immediately started to think about my next level of work over the next couple of days. You know, we had a big snowstorm in this metro area, and as I was driving, I received a text message from the superintendent saying that school is closed for the next 2 days because of the snow in Virginia. And I started to think about my students. You know, we have a backpack program where we send food home on Fridays. And as I listened to Dawn's story, immediately I started to think, well, what's going to be my plan to make sure that these students get the food they were supposed to get on Friday in their backpacks to go home? So that's a little bit of a challenge for me, and I'm hoping that as I finish here, I'll have a solution to that. But I'll go back to your question. So as an elementary principal, when I think about hunger in our schools, two things really come to mind. One has to do with discipline. Not a lot was said today about the issue of discipline, but I'm going to spend some time talking about that. And also the other one is instruction. When children come to school hungry, they are tired, lack of sleep. That caused them to be very, very irritable in schools, lack of focus, and this leads to severe behavioral issues at the school setting. When they're not focused, these problems we see manifest daily. Sometimes teachers don't know why. They ask questions. The children are embarrassed to say why they're feeling the way they're feeling because they don't want to share the fact that they are coming to school hungry because somehow mom and dad was not able to feed them. And when we see those discipline problems arise in our schools, it leads eventually to in-school suspension. It also leads to out-of-school suspension, depending on the severity of the issues. And in effect, put kids at a disadvantage in what we call a tiered system. And when we put kids in tiered systems, especially with discipline, as they move from elementary to middle school to high school, we heard earlier the fact that there's an increased chance of them dropping out of high school. And with the dropout rate, that have a direct correlation in terms of what we heard about the economy. Instructionally, when kids come to school hungry, they're not ready to learn. They're not focused. Instruction becomes secondary. When they go home on weekends, homework becomes an issue. They can't focus on doing homework. They don't have the parents to be able to spend time with them to get the homeworks done because they're trying to spend time trying to figure out how they're going to feed them. We ask kids to read daily. That becomes an issue. If I'm hungry on a weekend, there's no way in the world I'm going to read for 20 minutes to increase my literacy skills. We also see at the school level that students' reading levels either become flattened or it drops over the course of time. And that in itself have a huge impact on retention. So while I'm not a proponent of retention or social promotion, it does have an effect at the school level because what happens is when the children are retained, the chances of them dropping out of high school also increases. So programs such as SNAP, TANF, from what we've heard earlier, they are necessary for the survival of those students, their well-being, their health, and most importantly for our future. And we as a nation, we have an opportunity, we have an obligation to change the course for some of those students, and we have the right to do that, and we need to do that.
Thank you. Thank you. Carlos, as the director of a food bank in New Jersey, can you describe your clientele and the breadth of the services that you provide and the role of the private sector as a partner in tackling hunger?
Absolutely. So first, thank you for inviting me to be here to talk about the critical roles that not only SNAP play, but charitable food assistance play in both alleviating food security and helping families and individuals really get back on their feet. You know, as you mentioned, I'm executive director at the Food Bank of Monmouth and Ocean counties, and my food bank is nearly one of 200 food banks across the nation that are members of Feeding America, and together we provide about 3.7 billion meals to more than 46 million people each year. While it's true that when you see one food bank, you've seen one food bank, as a network, there's a lot of similarities in who we serve and how we serve. You know, unlike in some parts of the world, hunger in the United States isn't obvious, and you've heard that already this afternoon. Families that are struggling with hunger look just like anyone else. They exist in every state, every congressional district, and every county in America. They include people like Nurse C, who I met a few years ago, a single mom whose part-time earnings weren't enough to support her growing children, or M, an Iraqi war veteran who returned from serving our country and wound up having to juggle not only her own health needs, but that of her critical ill child as well. These are the faces that we serve. And it's not hard to imagine why the need has spiked so dramatically. First, a recession, and in the aftermath of Superstorm Sandy, both left our service area devastated. And we responded with service. Let me quantify that for you just a little bit. In 2007, we were distributing just under 4 million meals a year in 2 counties. Last year, we distributed more than 10 million meals to nearly 10% of the population, 132,000 people, through a network, an amazing network of 125 agency partners. These are idyllic suburban counties, communities that you and I hope to live in and live in. The people who are facing hunger in my community and around the country are people just like you and me. They played by the rules, they worked hard, but they ended up experiencing economic or health circumstances beyond their control. In our community, 69% of our adult clients have a post-high school education, and 62% of the households we serve include at least one working member. In fact, nearly 3 out of 10 of those households, there are 2 or more people that are working. But so often, they're experiencing challenges with underemployment, limited income, and poor health. Congressman McGovern is correct. people are working that we're serving. In many cases, our neighbors are facing heartbreaking trade-offs that make it very difficult, if not impossible, to get back on their feet. 81% have to choose between paying for utilities or food in the past year. 78% have to choose between paying for housing and food. 77% between food and transportation, and 77% between medical care and food. And we heard earlier that the mind comes second when you're hungry. So how do you work on furthering your career or improving the life of your family? We knew that at the Food Bank of Monmouth and Ocean Counties, we knew that it wasn't enough to provide food to those that turn to us. So we also work on efforts that we describe as shortening the line. We help to connect families to resources that can help stabilize their lives and get back on their feet. Our SNAP outreach and enrollment efforts, connecting families to the Earned Income Tax Credit and Child Tax Credit, as healthcare navigators, connecting families to public and private health insurance, through nutrition education, culinary training program, and partnerships, creative partnerships like the Financial Success Center and the soon-to-open Beat Center. These are some of the ways that we offer, that we go beyond emergency food assistance. We need a comprehensive approach. It's not an either-or. I'm really proud of the work that we do, not just in my food bank, but across our network. And I'm grateful for the generosity of volunteers, supporters, from food companies, retailers, farmers, restaurants, corporate funders, and generous individuals. This is a multi-sector initiative. And as the need grew exponentially during the recession and its aftermath, food banks rose to meet the need. But let me be very clear. We didn't, we couldn't, we can't do this alone. Federal nutrition programs, especially SNAP, did exactly what they were created to do in our community. They provided a lifeline for millions of families, children and seniors, not just in Monmouth and Ocean counties in New Jersey, but across our nation. It's interesting, by design, if not by intent, at the same time that our food distribution increased by 60%, we were doubling and tripling our efforts and working with our local counties. And guess what also increased? SNAP participation. And that's the way it should work. Things should work hand in hand if we even need those things altogether, as Congressman McGovern mentioned. Hunger is a solvable problem. We have food in most of our communities. We just need to create the financial access so that our neighbors can access that food. It can't be remedied through emergency food alone. Food banks and other charities are critical to hunger relief efforts, but we are a supplement, not a replacement for a strong and accessible federal anti-hunger safety net. The evidence of SNAP's short and long-term impacts is clear. Just heard from Dawn. How clearer could it get? Investing in SNAP and other nutrition programs isn't just the right thing to do. It's the smart thing to do. And we had a panel of academics, all with doctors in front of them, who shared that with us. So it's not just me saying it. It's a smart thing to do from a health perspective, from an education perspective, and definitely from an economic standpoint. It is, in fact, an investment in our future that has an impact in many of the neighbors that we call those that we serve. So thank you.
Thank you very much. Les, you've done a lot of work in human services, and can you discuss why the problem of hunger can become worse in the summer and the role of the Summer Electronic Benefits Program for helping children to address this problem? And I want to thank this administration in particular for their championing of that particular program, Kevin Concannon and Audrey Rowe and Tom Vilsack, and I mean, this has been a great effort, so thank you very much.
And also the state of Missouri and Area Resources for Community and Human Services would also like to thank the administration for their investment with this particular program. At Area Resources for Community and Human Services, or ARCHES as we call it locally in St. Louis, we're responsible for designing, managing, and evaluating education and social service programs. And when we got word from the governor's office that the state of Missouri was to participate in the summer EBT card program, we were thrilled, because we knew that there was a great need not only in the urban areas in our state, but also the rural counties as well. And so the summer EBT program operated in Missouri during the years of 2011 to 2013. Then there was a hiatus in 2014, and then the program resumed again this past year in 2015. Now, the SEBTC program, as we refer to it, explores alternate methods to feed low-income children during the summer. So it's not a redundancy of benefits, it's an add-on. The program is a benefit designated for children who attend pre-K through 12th grade and also receive free or reduced meals under the National School Breakfast and Free Lunch Program. The households chosen received extra funding per child monthly loaded onto an EBT card. And as a pilot, the program was only administered to less than approximately 1/5 of the eligible children and families across the districts. Now, in Missouri, we had a really what I would refer to as a unique collaborative effort. Of course, we had the approval of the governor's office, but then also the governor's office decided to add additional partners to the table, which involved the collaboration of 3 state agencies, which included the Departments of Elementary and Secondary Education, Health and Senior Services, and then also the Department of Social Services. So you had 3 state agencies working in tandem. Along with that, there were 3 community partnerships working in the local community as boots on the ground. They were the Local Investment Commission, or LINC, out of Kansas City, Area Resources for Community and Human Services, Arches in St. Louis, and then also Mississippi County Community Partnership, which is a rural partnership in Missouri operating out of the, near the Ozark Mountain area. Now, in the 4 years of the program, year 1 was considered the proof of concept year in 2011. And the initial demonstration pilot served approximately 2,500 children in 3 school districts in Kansas City. And in that particular, in that first year, the proof of concept year, there was great success and also great need. Information was being communicated across those school districts about the program, and there was a need to do more. And with those 2,500 students, over that 4-year period, expanded to 12,700 children, representing now 5 school districts, including Mississippi County and a large urban district in St. Louis. And just so you know, in St. Louis, the one urban district has approximately 22,000 students, and over 80% of those students qualify for free and reduced meals. So that's huge in terms of the need. And the program also added, and this is I think, worth mentioning, $4,650,000 in additional food stamp benefits to families in local communities, and served more than 22,500 households across the state of Missouri. And also worth noting is that the benefit redemption rates were very high, seeing somewhere between 90 to 94% utilization rates. And just to give you an example of how effective the program was and how timely the program was in St. Louis, Arches was responsible for the on-the-ground communication and sending information directly to families about the program. Frequently asked questions were developed and then submitted to families so that they could understand better how to access the program. Now, in some cases, families were not responsive, and we were trying to figure out why. So we had staff, in terms of boots on the ground, calling families, asking them about, did they receive the information about the program. One such household that we called, it was actually a grandmother who told us that her daughter had just had been hospitalized over several weeks and was going to experience an extended stay in the hospital. And as a result, she would now be responsible for feeding her grandchildren over the summer, in addition to her own child, who was also still school age. So now she had to bear that burden, and she had no idea how she was going to do that. Our staff person explained the program model, explained the specifics of the program. The mother started crying and expressing to the staff person at Arches that this is a program that she did not know that it even existed. And to receive a call like this at this time was very crucial and critical for her, because now she has a way to feed her family, and that she was going to immediately go to the grocery store and identify transportation services to get her there so that she can make this necessary purchase. So we saw it as a real example of kind of a way for government to intervene, provide timely intervention, and then also not creating an additional burden of identifying this person as a person in poverty, using an EBT card so that that family could maintain its anonymity and also their respect in the community. So we saw it as a real plus, and we appreciate the investment that was made on the part of the U.S. Department of Agriculture.
Thank you. Thank you. Dr. Hassink, as a pediatrician, how have you seen firsthand how SNAP programs help children and families in your practice? What do you do when a child shows up in your office who you know is from a food insecure family, but they may not be enrolled in SNAP? Do you refer them? And just one additional question. I talk to a lot of medical students all the time. When I ask them how many courses they've taken on nutrition, they don't oftentimes say very many. Do you think we ought to urge our medical schools to put more of a focus on nutrition, given the fact that food is medicine?
Let me take that one first. Yes.
Okay, good.
Yes, I do. Yes, we should.
Good.
We are. So let me tell you about a family. I ran an obesity weight management clinic, and I was following this family. I had met the mom and dad and the two children for obesity, and the father had fairly significant obesity himself. And while I was following this family, he passed away from the complications of obesity in his mid-40s. And I didn't see the mother for a little bit of time, and then she showed up at clinic and she was crying. They had been thrown back economically, and touching upon your story, they couldn't afford the healthy food. At that time, she had not been aware of what programs might be available, and the kids were gaining weight, and so they were experiencing the same problem as their father. It was exacerbating because of the father's death and their economic situation, and she couldn't. And she came in crying, and we began to link her with food programs and other assistance. So in that scenario, you often find out about food insecurity in ways that you don't expect, by people just as you begin to uncover problems, you uncover it. And this is why we're recommending that we ask up front. I also want to tell you a story about a colleague, and this, Dawn, you made me think of this. I was lecturing last summer in a big educational venue for medical providers, and I had been speaking about, I just finished giving a lecture about obesity and food insecurity, and a woman stood up at the microphone, and she began to cry, and she said, she was an attendee at the conference, and she said, I have experienced and am experiencing food insecurity. And she began to talk about that. And I'm at the podium, and I'm feeling very stuck because I'm up here, she's down there, and I said, somebody please take her information. But she was so upset she ran out of the conference. And I tracked her down, and I emailed her and asked her if she needed help. And she was in a situation where she was a nursing student. She had a child. She was working as a medical assistant in a pediatrician's office, and could not get enough food by the end of the month to feed her child. And we did connect her with resources. But it's a very powerful experience when your own colleagues are standing up now and telling you they're food insecure. I'll also tell you one last story about a grandmother who she had brought her grandchild in. The daughter was overweight, and we were talking about getting healthier food, and that would require some shift of the budget to get healthier food. And she said, no, I'm not going to do that because I buy extra food, because by the end of the month, I am feeding all the children in my apartment complex because they're running out of food. So she's compromising her own food budget so she can feed the rest of the children. So I tell you those 3 vignettes because just to expound upon the story that it's not always what you think. Hunger has many, many faces. So.
Thank you. Don, how did your experience with hunger and receiving SNAP change you as a nurse? And you talked about how you've transitioned off of SNAP, and now you're doing the things that you really like. But can you tell us, I mean, what kind of assistance did you get to make that transition off?
The only assistance I received to transition off of SNAP was a job. That's pretty much it. A job. I worked for the Attorney General's office in Idaho as a paralegal. Reason being, I've been a nurse for 25 years. I blew out my knee, couldn't work as a nurse for a while, got the knee fixed, went back to work as a nurse. So, and it was just a job. So, and it was weird because the way SNAP is figured, you qualify for 6 months, you recertify every 6 months. So they calculated my 5 months of income from the AG's office for the 6 months, and I still qualified. And I don't know that our Attorney General would have liked that very much. But as a nurse,
Pay better.
yeah. He's a very nice man. And as a nurse, yes, I did take nutrition in school, and I know that you don't give gravy to somebody who has high cholesterol or salt for somebody who's got congestive heart failure, and, give them sherbet if they're diabetic. But one thing I've learned, and now I'm the oversight nurse for 7 small assisted living homes, and residents upon admission stop eating because they've lost their home, they've lost their car, they've lost their driver's license, grandpa can't drive anymore, grandpa's gonna drive off the road, and the only thing they can control is their food and their pills. So I, now instead of waiting for my RN supervisor to email me once a month the weights so I can let the doctor know, get them on Ensure, whatever, I now monitor weights weekly. And, if somebody's lost a half a pound, I know it, and I am faxing a doctor, I'm calling somebody, I'm texting somebody, Glucerna, I need something. And it affects their congestive heart failure, their dementia, they're hostile. But they're hostile because they're hungry, but they're hungry because they're lost control, and it's just this horrible little cycle. So I really watch their weight. And I now have home administrators call me and say, so-and-so didn't eat dinner for 2 days, and I said, well, you ask them what they want, and we will fix them, whatever it is. I don't care what it is, just get them to eat something.
Thank you. Mr. Mitchell, we've heard a lot of discussion about how the SNAP benefit is inadequate, doesn't last the whole month. Oftentimes, families end up going to food banks and food pantries and churches and synagogues or mosques to get, additional food. You talked about kind of the relationship between this discipline and behavior and food insecurity and hunger. I mean, do you notice toward the end of the month that the behavioral issues get more intense?
Absolutely, yes. I work at a school where 80% of our students qualify for free and reduced lunch. So we are very thankful to the administration for the work that they've put in reference to providing the EBT cards, the SNAP, and also just increasing the support to provide the free and reduced meals at the school level. I will say to you that at the end of the month, a couple of things arise. One has to do with attendance. This is something that we really don't speak a whole lot about, but attendance is absolutely critical when it comes to the school setting. Children, at the end of the month, they don't come to school because they didn't get a chance to eat the night before. And so therefore the parents somehow, some way are afraid to send them to school. Even though we do offer free lunch, which I'll talk a little bit more about later, some of the things that we do creatively to address that issue. But attendance is a huge problem. If they're not there, we can't feed them. If their parents can't get them out of bed to get them to school, we can't feed them. If the parents are not at their homes to make sure that they get on the school bus, we can't feed them. So attendance is a huge issue. The other issue that I see as a school level principal, I mentioned earlier briefly, is the issue of discipline. But discipline in reference to the volume of referrals at the end of the month, which lead to classroom teachers referring students to what we call the intervention team. And for those of us who, who've gone to, who've maybe part of, well, I don't know how many educators we have in the room, but at the school setting, through the intervention team, that is when we provide services and we look at support for students. And when those support turns out to be inadequate, we try to look at other avenues, such as special education. And it gets a very negative connotation, but the fact of the matter is that teachers tend to refer children more so at the end of the month to the special education process, which then allows us, whether it's right or wrong, in a lot of cases, overqualifying students, especially minority students, especially boys, especially African American and Hispanic boys, in terms of the special education process. That in itself have a direct correlation to the fact that these children are coming to school hungry, their discipline referrals are increased exponentially. The other thing that we see at the school level is we are responsible. We live in a nation where we test and we test and we test all our students. I'm very thankful with the ESSA legislation that we'll have some reduction there. But when we test students at the end of the month, we don't get the results as we should get because the children are not focused. They are not giving us their best effort because their minds are someplace else. So what we try to do at my school is we try to test students at the beginning towards the 1st and the 15th of the month to try to do things a little bit differently. So that way we address those instructional needs. So I would say those are the three things that really kind of arise for me.
Thank you. Yeah, Carlos, in your work, what has been the most effective way to improve a family's financial health?
I think one of the key things in our community is that many of the families that we serve, especially during this time of spike, find local pantries and emergency food providers first. And part of the reason is that that's where they used to volunteer and donate to. And so what we found effective is, yes, you meet someone where they are. It's the old social work saying. But you quickly learn a little bit more about them and introduce them to resources that will have more long-term stability and or short-term stability. And simply put, that's just connecting families to food stamps, SNAP program, during the tax season, which is starting for us now, making sure we invite them back, because most of them are working to file their taxes for free, and figure out different ways to really just engage them. And it's interesting, because one of the things that we have to do, and so many folks have mentioned it today, is we really have to stop demonizing these programs. We have to start describing them in a way that shows the asset and the resource and the value for themselves. Having the opportunity to run both a free tax assistance program through the VITA program and doing SNAP outreach and enrollment, I find it interesting that no one ever cries when they go in and ask the IRS for a refund. Right. But when you apply for SNAP, they do. And what is the difference in the transaction? They're both giving a family resources that they desperately need to stabilize or move themselves up further. That's what we have to do. Let's stop demonizing the program. Let's start describing it, not just in these environments to really paint the picture, but let's make sure that we understand that the audience is also the neighbors that we're trying to serve as well.
And the final question before we go to audience questions, so turn in your cards. Les, can you describe key barriers in the traditional summer food service program, and if you could share with us some stories about how the Summer Electronic Benefits Pilot Program is more effective in helping children?
Sure. For families who qualify for free and reduced meals through the National Free Lunch Program, for some families, this is the best meal for the children, it's the best meal that they'll receive for that day. Let me repeat that. For families who rely on that free lunch program and they qualify for free and reduced meals, for those children who participate in the program, that's probably the best meal that they'll receive during that day. So when we move and transition into the summer months, they don't have access to those feeding programs. When they don't have access to those feeding programs, children go hungry. Children can't advocate for themselves. They can't call the schools. They're not able to call a social worker and say, I need assistance. So this program, the EBT program, was very intuitive. It was very proactive. It allowed for families to receive benefits that would carry them through the summer months. In some cases, when we were looking at the data, the aggregate data, then individual household level data, identifying how much funding was still left on the table, because it was time specified in terms of we had to spend all the funding because it was a pilot program by a certain time period. We looked at some of the families, and staff made calls and say, hey, you've got a balance remaining on your EBT card. And they're saying, but we're trying to budget. I don't want to spend all the money this month. I'm budgeting, would like to transfer that budget or that balance forward to the next month. And so contrary to popular belief, these families are intentionally looking at their budgets for the month, looking at where the gaps are in terms of their household needs, and making very conscious decisions on how to spend that money. And I think that's excellent. And I think we should applaud our families, and I think we underestimate the level of sophistication in which they operate. One example, real quickly, in terms of a boots on the ground example, from one of the parents that we were servicing. The mother received the letter in the mail that she would be receiving the benefit. She called to say, again, another situation where she called to say that her sister passed away suddenly. No life insurance benefits or death benefits involved. And then now she would bear the burden of having to care for her sister's children, adding again to the need of the household and adding on to their food insecurity needs. And so this program was able to provide real-time load cash onto the benefit card so that mom could then provide for her sister's children and her own children. And so when the program ended, we received a lot of phone calls from families because other families in the community found out about the program. We were utilizing texting services, a 24-hour communications customer care center to reach out to parents, explain to them about the program. The customer care center was also able to make outbound and receive inbound calls from families to learn more about the program. So we had done such a great job in marketing the program on behalf of the state of Missouri, on behalf of the funder, the USDA, that parents were now saying, hey, I need this assistance too. And why is this only available to a small demonstration or a pilot group and not the entire district? So that's been our experience in Missouri.
Thank you. So I think we're at the point where we're ready for audience questions, and so.
Sure, great. And thanks for your questions. Please keep them coming. We'll pick them up. And I should have noted, in addition to you all here, a full house here in Southcourt Auditorium, we have folks watching from across the country on wh.gov/live. And so, hello to everyone.
Hello to all. We didn't know
okay.
you were watching us.
Again, some great questions. I wish we could read them all. This question is to Dawn. Thank you for sharing your story.
Welcome.
How do you, for you and for really all the panelists, how do you work with families, and how did you work with yourself and your family in dealing with kind of the shame and stigma and stereotype around food insecurity and the federal safety net?
I shopped at night. Our Walmart and our local huge grocery store is open 24 hours, so there's no lines at 2 a.m. So nobody has to look at my cart at the beginning of the month because, you shop for the whole entire month. And the eye rolling comes when you've got this packed cart full of food, and that tells them exactly how you're paying for your food. That's just what people know. I mean, it's Idaho. So, and I actually went over to another town to shop a couple of times. I was verbally accosted at the grocery store one time by a woman who was very disgusted that she had to stand in line behind people, using their Quest card because she works for a living and she pays taxes and she can't afford all the kinds of foods they're affording. And all I can think of is, it's for the whole month, lady. She comes to the store 3 times a week. I go to the store once a month. It shouldn't be I learned a new word today, demonized. I didn't realize that's what it was, but it is. I have friends who talk about, my boyfriend walked out and he was paying half the bills and now I can't afford to buy food and pay the power bill, and I take them down to health and welfare and say, we're gonna do this. It helps people. It shouldn't be a horrible thing.
Thanks.
So I'll just say, so one of the things that we've done by asking pediatricians to address it, and we do teach them motivational interviewing and techniques to ask questions, is to sort of normalize the questions. So it becomes just part of what people expect to be asked when they come into the office. And that's one of the ways we're trying to just sort of make it routine.
So, Dr. Hassing,
Yeah.
just to follow on to that, what happens next? You ask about food insecurity,
Yeah.
and then what steps are pediatricians being instructed to take? And related, are there tools that would make that easier and more effective for you and other pediatricians?
So we've asked them to be aware of their local community food resources, and there are websites, and we don't have a food insecurity toolkit yet. Usually we do roll one out after we've asked them to do this. But we do know that they're operating out of medical homes, and they do have connections to the community, but interestingly, the connections they haven't made are to the food banks. So we've asked them to sort of put that in their mind about this is another really important community connection. We also have asked them specifically to make sure that eligible families are enrolled in federal food programs and are taking advantage of the food programs. And we have already asked them, because we've been working a lot on obesity, just about basic counseling about optimizing healthy nutrition and eliminating high-risk nutritional behaviors that would compromise health. So we're on the road. I don't think we have it solved, but we have taken the first steps.
Just to add to that, we're kind of meeting from the other side and kind of working to that common middle. One of the things that we've done is, with one of our teaching hospitals, is we had a similar kind of food security forum a couple of years back, and it was an aha moment. Yeah, none of our residents asked those two basic food insecurity questions. And since then, they've started. And we started working on collaborations that go as far as looking at where community health assessments point to certain issues and where our food distribution goes and where we can start targeting more heart-friendly, health-friendly types of food, or connecting families with resources. Again, in this particular community that I serve, there is a vast need to really increase participation in some of these federal programs. Many families were just simply not eligible before. This is a foreign concept. Suburbia does not have the infrastructure for processing human services that we may come to expect in different areas. So I think, to your point, we have to introduce the conversation, do it in a way that's more accepting, that normalizes it, and then figure out very practical ways to create these linkages.
I'll go with another question. This room is inquisitive this afternoon. Mr. Mitchell, I have a couple of questions that are both related to making sure schools really make use of the full suite of federal nutrition programs. So as a principal, could you provide any perspective on effective ways to communicate with schools and make sure that they really do make use of the full suite of federal nutrition programs?
Sure. Well, as you know, Virginia is one of the states where a lot of families receive those direct SNAP benefits. Earlier, we heard from the secretary about the piece in reference to Medicaid, and as part of a direct way of qualifying for free and reduced lunch services. I think that is going to be crucial moving forward, besides just the SNAP and the TANF. You know, the children automatically qualify at the school level, but the message that principals need to keep in mind, not just in Virginia, but across the country, is that we have to make sure that we reach out to those families in terms of ensuring that their application process does not lapse. That is absolutely critical to make sure things are done in a timely manner, and so that the benefits can continue. At the school level, it's also very important for you to be creative in terms of the way in which you provide breakfast and lunch services to students. When most of us went to school, typically we went through a line, we get a tray, we go through the line, we get our tray, we go to a table where we all sat and we had lunch. Well, what we're doing at my school and also at the state of in Virginia with the governor's initiative is to find alternate models of serving breakfast and lunch to students. And so one of the models that we implemented, and we did some work with No Child Hungry, and we call it what we call a grab-and-go breakfast, where students going through the line, they grab their breakfast, it comes in the form of a bag, they grab their drink, and they go directly to the classroom. That has a significant impact in terms of instruction because we can start our day immediately besides waiting 15, 20, 30, sometimes 40 minutes for kids to eat in the cafeteria. That's one model. The other thing that we do that's absolutely critical is we do breakfast in the classroom, family style, especially for our youngsters, our Head Start kids, our kindergartners. So that way they get the opportunity to get a feel to really have breakfast as a family, as a group in the classroom. And for the high school levels, but we do that at the elementary too. Kids come to school late. Attendance is an issue, especially at a high, low socioeconomic school. So we provide second chance breakfast. So if you come in at 10 o'clock, you eat. You come at 11, you eat. You come at 9, you eat. Regardless of whether or not breakfast is over. And that's what we try to do at our school.
Great, thanks. So I think we have time for about 2 questions. So maybe I'll do one and you do one. Deal? Okay. So one questioner rightly notes that you all are clearly leaders in your respective fields. What's next? What are you trying to do in the next year or 2 years, again, to support kids and families battling food insecurity?
So I'll start. We have the next big issue, and we will shortly issue a policy statement on poverty and the health effects of poverty, which I think will help tie directly into this issue. It will address a lot of the factors we talked about today, and again, put health-related effects of poverty on the radar screen of the pediatricians. So that's one of the things. We will continue to speak about the combined nutritional burden of obesity and food insecurity in this country, sort of highlighting the magnitude of the problem. So I think our conversations will continue to sort of highlight this isn't a problem here that's siloed over here with hunger or over here with obesity and overweight. This is one problem, and it's the one problem of not being able to feed the children, and continue to train the pediatricians in communications techniques. The other thing we're addressing aggressively around obesity, and it sounds like we need to sort of address it around food insecurity, are teasing and bullying that go on. And we have a big effort around that.
From my perspective at the school level, I think what's next for us is, one, is to continue to expand our backpack program to provide kids opportunities during the weekend. But I think the bigger picture really is to continue to work with our elected officials so that they can work collaboratively with Secretary Vilsack to make sure that 100% of our students and schools, we should have a model in place in this country whereby 100% of students should be able to allow to get a free or breakfast program, especially in schools with high poverty. I think it's a necessity. So whatever work that we need to do as educators, that is, to get with the policymakers, I think that's definitely where the next step needs to be, to make sure that all kids have access to free and reduced meals.
I think from the Archer's perspective, you have to look at public-private partnerships to address not only hunger, but also workforce development strategies. One way to pull families out of poverty is to identify evidence-based workforce development strategies. And in order to do that, it takes money. It takes an investment. It takes an investment from the Department of Labor. It takes an investment from the Department of the Bureau of Justice, and looking at those persons that have criminal records that may be, and that may be one reason why they're not able to enter into the workforce. And then looking at some of the policies impacting folks as they transition from welfare to work. and not penalize those individuals as they attempt to transition from unemployed to employed. And that would go a really long way in helping to at least begin to deal with these issues in a very real fashion.
All right, our last question of the day. We're going to break protocol a little bit, if Mr. McGovern is willing, because we have a question for you.
Oh, okay.
All right.
The answer is yes, whatever you want.
That's awesome.
From everything we've heard today, we have great data, and we've heard a lot of stories. And so the question we have is, what can we, coming from the audience, what can we do to enable you to more effectively convince your colleagues about the importance and effectiveness of the full suite of federal nutrition programs?
Well, first, everybody in the first and second panel can run for Congress. That would make it. But, you know, look, we need to build a bipartisan consensus around these issues. And there are, you know, people on both sides who I think we can bring together. You know, I work, I'm the ranking Democrat on the Subcommittee on Nutrition and Agriculture. Jackie Walorski is the chairwoman. When you talk about the issues that we've talked about here today, I think she's very, very sympathetic. Lynn Jenkins, a Republican from Kansas, is the co-chair of the House Hunger Caucus. She's going to invite me out to Kansas to look at some of the challenges that they're dealing with, and I'm going to invite her to Massachusetts so that she can see some of the issues that we're dealing with, and hopefully we can learn from each other and maybe, start to, form a partnership where we can move some stuff. But when I began kind of harshly in my critique of some of the conversations in Congress, that I think are indifferent and sometimes even based on ignorance, is because if you listen to some of the debates, they seem driven not by the realities, but by, something else. I don't know whether it's ideology or whatever, but the reality is when people talk about SNAP in Congress, you would think it's the most wasteful program in the history of the United States of America, when it is probably the most efficiently run program we have with with the lowest fraud rate of any other federal program. It works, and it is being run the way we all want it to be run. But that is not what you hear on the floor. So we need to respond to that. Don's story here is important because there is a perception that once you get on SNAP, you never ever want to get off of SNAP, or that no one ever does. That's not the reality. It's not the reality. It is an investment. And investing in Don was worth every cent. And there are, countless stories like this where people, have graduated off of SNAP and they're doing great. Everything's wonderful. And we need to tell those stories. We also need to remind people what the benefit is. I'm on the Agriculture Committee, and I think if I put everybody on the spot of the committee, what is the average SNAP benefit? They would have no idea. They wouldn't know it's $1.40 per meal per day. They would say it's a lot, they'd say, or it's adequate or whatever, but they don't know what it is. It is not adequate. And I want to thank the White House, by the way, the Council on Economic Advisors who did a report actually, emphasizing that fact. And I also saw some people here today from the National Hunger Commission. I want to thank them for especially focusing on children and the recommendations in their report that kind of complement what the White House is announcing today. But look, I also would say invite your Congress people to a food bank. Invite them to a school. Have them learn about the school feeding programs. Bring them on tours to see the summer feeding programs. And while we're at it, can I just say one thing? Being on a lot of tours of school feeding programs, I have one recommendation. We ought to make lunch a little longer so the kids can actually eat their food and not have to breathe their food in.
I agree.
It takes a while to eat an apple, and if I don't have enough time, I won't do it. But anyway, part of it is just we need more advocacy. So that's what we need. Thank you.